Pratt-Chapman, the director of the George Washington University Cancer Institute.
Hi, and good morning. We're still in the morning, not quite afternoon. Thank you so much for joining us today. We're really excited about this project, and we're excited about working with all of you. So I'm just going to go through our agenda, what we'll be covering on the call today. We'll go through some introductions first. We'll talk about the purpose of the call and then give you a brief overview of the project and the role that we're hoping the AHEC centers will play on the project. We want to talk about engagement and expectations on your side and ideas that you might have to make sure that we're working together most productively. And then we'll wrap up with final thoughts and next steps. So again, I want to thank everyone for participating. The people who were invited to be on this call were AHECs who provided a letter of support for the proposal. And since we did receive the award, we're now following up with everyone, and we thank you for your patience as we kind of got up to speed, got Gretchen hired, started rolling out the project so that we could have something meaningful to talk with you about on this call today. Joining me for this presentation is Ann Willis, the project director. She is also in the room. Gretchen Kolsky, who already introduced herself, she will be your point of contact and the project manager for the full project. And Kaneko Kashima, who is one of our research assistants for the project.
And this is Rob Trachtenberg. Good morning, everyone. Can you hear me okay? Can everyone hear me?
I think they probably have their phones muted.
Okay, good. I was hearing some clicking. Well, I'd like to say a special hello and welcome to all the AHECs who are on the call, and good morning to everyone. And so glad that you're considering being part of this project. Just a very brief bit of history that last December I did get a chance to meet with the George Washington Cancer Institute folks, and we're very much looking forward to a partnership that we hope will lead to a stronger partnership on a variety of other activities as well. We have a great webinar in store for you this morning, and we're eager to get going. Thank you.
Perfect. So now if you would unmute your lines, we actually would like to hear from all of you. If you could just briefly introduce yourself and say the role that you play at your AHEC. We'd like to know from you who's on the call.
This is Edna Apostol. I am the CEO at Gulf Coast South Area Health Education Center in Sarasota, Florida. And I have with me Ansley Mora, who is very experienced in facilitating this type of effort within our region. So I want her to say a little bit about that.
Hi there, this is Ansley Mora, and I am interested to learn more about the project. I've been working with the Southwest Cancer Control Collaborative for several years now. So I kind of understand the needs that are there. So we look forward to learning more.
Great. Who else do we have with us on the call?
Hi, this is Andy Fossmeyer. I'm the Executive Director of Northwest Oklahoma AHEC in Enid, Oklahoma, and we've been working for several years with the Oklahoma Comprehensive Cancer Care and Livestrong Foundation.
Wonderful. Who else?
This is Rachel Chase with Swanee River Area Health Education Center in Central Florida, and we are currently exploring partnership with the Screen for Life program that's administered locally here.
Wonderful.
This is Lori Milner, Director of the DFW Area Health Education Center Director.
Hello, this is David Gross. I'm Director of the Northeast Kentucky Area Health Education Center in Moorhead, Kentucky, and I have with me our Continuing Education Administrator, Chris Salyers. We do a pretty broad range of educational programming, and really looking forward to the possibility of having a cancer-focused program in our region in the near future.
Great.
Mary Craig from the Erie Niagara AHEC in Buffalo, New York, and we work very closely with our partner Roswell Park Cancer Institute.
Great.
This is Carolyn Minnock. I'm with Charlotte, North Carolina AHEC, and I'm Director of CME and Pharmacy. And on the line, I also have two other people from our team, my Assistant Director and one of our project coordinators.
Wonderful. Thank you.
This is Dwayne Harris with the Southern Kentucky AHEC in Mount Vernon, Kentucky.
Thank you,
Paula
Dwayne.
Overfelt. Sorry, I'm Paula Overfelt with Northwest Missouri AHEC in St. Joseph, Missouri, representing Missouri.
Thank you, Paula.
Hi, this is Gretchen Forsell, Director, Northern Nebraska AHEC, and we work very closely with the regional Johnny Carson Cancer Center.
Thank you, Gretchen.
This is Linda Cragen from the Massachusetts AHEC. I'm trying to decide which center would be better to be involved in this project.
Okay, thanks, Linda. Who else do we have?
Hi, my name is Regina Knox. I'm with the West Central Alabama AHEC, and I'm representing the state of Alabama, and we're located in Greensboro, Alabama.
Thank you, Regina.
This
is Tommy Sweat with Canyon Panhandle. Go ahead. Excuse me. Never mind.
Okay, so we have Tommy Sweat, and who else was trying?
Jackie Shanuday, Gordon AHEC.
Thank you, Jackie.
In New Jersey. Thank you.
And anyone else who's with us?
This is Stephanie Montaño, and I'm with Panhandle AHEC in Canyon, Texas.
Thank you.
Teresa Strum, Northwest Illinois, AHEC Center Director.
Thank you, Teresa.
Hi, this is, go ahead.
Northeast Area Health Education Center in South Dakota.
This is actually Tricia Hinseth from Yankton Rural AHEC that's also in South Dakota.
Okay, great.
Jeff Paffke, Cascades East AHEC, Bend, Oregon.
Thanks, Jeff. Anyone else? Okay, well, thank you all for joining us. We really appreciate and are excited about working with you. We'll go ahead and move forward. So again, the purpose of the call today is really to provide a brief overview of the project and discuss ways that we can engage with each other so that AHECs can be involved with this work, and also get your thoughts in terms of different modes of engagement and ways to involve you. So I'm going to turn this over to Gretchen to do an overview of the overall project.
Thanks, Mandy. And just a quick reminder to have everybody mute their lines again, if you haven't already done so. So we thought it would be helpful before we dove into the role of AHECs in our project to kind of back up for a moment and provide you with a brief overview of comprehensive cancer control and the project itself. Comprehensive cancer control is an integrated and coordinated approach to reducing cancer incidence, morbidity, and mortality through prevention, early detection, treatment, rehabilitation, and palliation. These efforts encourage healthy lifestyles, promote recommended cancer screening guidelines and tests, increase access to quality cancer care, and improve quality of life for cancer survivors. It is a process by which communities and partner organizations pool their resources to reduce the burden of cancer. These combined efforts help to reduce cancer risk, find cancers earlier, improve treatments, increase the number of people who survive cancer, and improve the quality of life for cancer survivors. The CDC started the National Comprehensive Cancer Control Program, also called the NCCCP, to help states, tribes, and territories establish coalitions, assess the burden of cancer, determine program priorities, and develop and implement cancer plans to address priorities and needs. The comprehensive cancer control programs are funded by the Centers for Disease Control and Prevention and exist in all 50 states, Washington, D.C., 7 tribes and tribal organizations, and in 7 U.S. associated Pacific Islands and territories. These programs have a shared goal of reducing cancer and improving survivors' quality of life. Priorities of the National Comprehensive Cancer Control Program include emphasizing primary prevention of cancer, supporting early detection and treatment activities, addressing public health needs of cancer survivors, implementing policy, systems, and environmental changes to guide sustainable cancer control, promoting health equity as it relates to cancer control, and demonstrating outcomes through evaluation. The CDC's Division of Cancer Prevention and Control sought to fund national organizations to conduct core activities and provide high-quality technical assistance and training to these national comprehensive cancer control funded programs and their partners. The CDC articulated 4 primary focus areas for this work: local implementation of comprehensive cancer control activities, identification and implementation of systems and environmental change strategies that promote health, support healthy behaviors, and facilitate community clinical linkages to build support for interventions to prevent and reduce the cancer burden, enhancement and sustainability of partnerships, and finally, support for communication strategies to promote CCC program successes and the leveraging of additional resources for cancer control and prevention. And so now we're going to come to the award itself. The GW Cancer Institute is proud that we were awarded a $2.1 million cooperative agreement to work with the CDC to design and implement this comprehensive technical assistance plan. This plan will support the CDC-funded programs. The GW Cancer Institute will leverage existing infrastructure, capacity, and relationships to provide technical assistance to comprehensive cancer control programs to help reduce the burden of cancer with a focus on local implementation of comprehensive cancer control activities, systems and environmental changes, sustainable partnerships, and communication strategies. We're going to go over the main foci of the project, and as I'm sure you can imagine, this is a very large and complex project and will take place over the course of 5 years. And we will focus on the following main activities. We will leverage the Institute's existing online academy to develop and implement multiple online trainings to expand public health skills and address comprehensive cancer control priority areas. We will create resource guides to help public health practitioners more easily translate existing evidence into practice. We will connect comprehensive cancer control practitioners with experts, including researchers and peers, and facilitate the sharing of evidence-based interventions and promising practices. We will convene stakeholders to identify opportunities for integrating cancer prevention with other chronic disease prevention efforts. We'll provide large group, small group, and one-on-one technical assistance for comprehensive cancer control grantees and coalitions. And finally, we will create easier ways to align local initiatives with national health priority indicators. And now that the project is underway, as Mandy mentioned earlier, we wanted to convene the group, talk about the specifics of the role of AHECs in this project, and solicit your input and feedback about working together on this project going forward. We chose to partner with AHECs because of your focus on public health workforce development, your ability to reach and engage with your local communities, and your existing relationships. Mandy will speak more specifically to the role of AHECs in the project in greater detail in a few moments. But first, we wanted to give you all an opportunity to ask any questions you may have about the project itself. Please utilize the Q&A box or unmute your line to ask your question, and we're now opening the floor for questions.
So I'll just wait a minute to see if anyone has a question. I will be talking about your specific role as planned in just a moment, but does anyone have questions about what Gretchen went through in terms of the scope of the agreement and the goals for this project? There's a lot of information, so. Okay, I'm going to go ahead and move forward with the anticipated role of the AHECs, and we can certainly take questions later down the line as we have our discussion as well. So the role of the AHEC centers in this project, we partnered with AHECs on the proposal phase of this project because of your breadth across the country, the spread of your centers across the country, and your use of evidence-based and promising practices, your focus on workforce development, and your focus on the underserved, and the linkages you bring between academic medicine and the community. So we know that a strength of the AHEC network is its ability to adapt national initiatives to help address the local priorities in your communities, since you know your communities the best. And since one of CDC's priorities is really to start integrating cancer control activities with broader chronic disease prevention efforts, you're really a wonderful partner to try to, again, catalyze some of that grassroots change and that local level change to help move this forward, since everyone is kind of dealing with fewer resources and there are a lot of common needs from cancer control and chronic disease prevention. So as proposed in the project, in the proposal sent to CDC, which was funded, we had proposed we would host regional roundtables at 5 AHEC sites each year, starting next year, so years 2, 3, and 4 on the project, for a total of 15 sites over the lifetime of the project. And the goals of these roundtables are really to talk about successes, challenges, and resources that are needed to better integrate cancer and chronic disease efforts. So we'll be talking about that process a little bit more shortly, but that was one of the major initiatives for the AHEC centers. We also want to work with the CDC and the National AHEC organization to identify 1 or 2 AHECs in each of the 10 regions that will be responsible for hosting these community health roundtables with the Comprehensive Cancer Control Coalition. Again, the goal of the roundtables are to facilitate community partnerships, share evidence-based interventions and promising practices, and ultimately develop a report to inform comprehensive cancer control efforts, focusing on the chronic disease framework. So our role at GW on the project will be to work with the project steering committee and on the AHECs on establishing the agenda and outcomes of the roundtable. And the AHEC Center's role will be to identify key stakeholders and participants and facilitate the roundtables. So with that, I'm going to turn it back over to Rob.
Great. Thanks, Mandy. And as you do take a look at the screen, you can see 2 primary questions. How can we be most helpful with integrating AHECs with comprehensive cancer control programs? And what would help you bridge these alliances? And what resources would be best for building and providing support to those relationships? So as I talked just a little bit about the site selection process, the steering committee, and potential other engagement mechanisms, please keep those 2 questions in mind and start thinking as we then move to more of an open dialogue. And again, if you have questions, please put them in the chat in the lower right. AHEC site engagement, as was mentioned, is over the lifetime of the project, and planning will take place in year 1, where we're at right now, and roundtables will take place in years 2, 3, and 4. There will be an application that will be created to select the roundtable sites, and the goal is to have a variety of sites selected for the roundtables, perhaps looking at geographic location, some distribution into underserved rural, urban, frontier areas, what level of integration with chronic disease the AHECs have, and perhaps other special populations that any of you on the call may be working with at your AHEC. So as you consider the site selection process, think about the factors that are important to consider for that, and also know that we're creating, or the project is creating, a steering committee, and the steering committee will have representation from the comprehensive cancer control programs, other AHECs that perhaps may not be selected for the roundtables, the George Washington School of Public Health and Health Services faculty, the CDC staff, and CCC national partner organizations. And the steering committee will largely be responsible for participating in quarterly virtual meetings through webinars like this, other teleconferences, and conference calls that we've all been on a million times over the years. And the advisory board will provide that key strategic direction on project activities. So please start thinking about how you may be otherwise engaged should you not be selected for the roundtable or the steering committee. And you can, again, refer back to those questions on the slide and consider how you might want to build on existing experiences, existing partnerships, to move this initiative forward in a very comprehensive way. And Mandy's going to talk about those in just a few moments.
Great. So we wanted to now have you all unmute your lines, and we wanted to get your thoughts on other opportunities for AHEC engagement on this project. We wanted to gather some information on your current roles and activities and get your thoughts on how we can best be of assistance. So first we're going to do a quick poll. if you should see on your screen a question, rate the strength of your relationship with comprehensive cancer control programs on a scale of 1 to 5, with 1 being very weak and 5 being very strong. Just so we can get a snapshot of kind of what your existing relationships look like. And there's no right or wrong. The point is to just strengthen wherever we're at. So I think we have, I think everyone has answered. So it looks like the majority indicate that their relationships, almost half indicate that relationships are pretty weak with a rating of 1, and then others rank 2 or 3. So no one has indicated that they have an extremely strong relationship with the comprehensive cancer groups, which is kind of great because it's an opportunity. The whole point of this project is really to help bridge some of those alliances and create new relationships and synergies in your communities to help with that integration. So thank you for participating in the poll. So if you could now unmute your lines and let us know what would be most helpful to you based on the knowledge that you have about comprehensive cancer control and what you do now, what would be most helpful in integrating your centers with these comprehensive cancer control programs?
Yeah, this
is Edna from Gulf Coast South AHEC. I have a quick question.
Sure.
And it's not related to what AHECs can do about this, but what is the knowledge at this point of the collaborative in terms of the expectation that they work with AHECs?
So the comprehensive cancer control groups don't have a requirement to work with AHEC centers. We just saw this as an opportunity since you bring a lot to health in your local communities, and they have a pretty significant mandate that is not very well funded, and so bringing folks together to try to share goals was what we were looking at. They don't have a requirement to work with you.
Well, are you, as part of this project, will you be hosting like some kind of conference call with them or something to let them know of this, or that would be part of the expectations that AHEC kind of do that?
That's a great recommendation. So if AHEC centers had existing relationships, I mean, all of this is kind of, we're just talking about it now. So if you had a very strong relationship and knew kind of who everybody was, then we could have the AHEC center do that. If you need a conversation starter, then Gretchen can certainly look at the contacts we have in your region, set up a conference call, and get the ball, help you get the ball rolling. So, that could be a recommendation in ways that we can help bring together key points of contact to make this work.
Thank you. And just to clarify the process, this is Ansley with Gulf Coast South AHEC. Each of the states have a Florida or a cancer plan, and I assume there's some staff working on that project to disseminate information to the different collaboratives around each state. Do you know is that the way it's designed?
So each of the states have a cancer control plan. Some states are more active in implementation than others. Some have more resources than others. Some have more staff than others. So the cancer control plan is a good place to start. If you're interested and selected to be a roundtable site, looking up your local cancer control plan is a wonderful place to start. It may or may not reflect actual activities that are happening in your area. It mostly reflects the goals that have been established for what the coalition thinks needs to happen. I hope that answers your question.
Yes, it helps. Thank you.
Andy, it sounded like you had a question too.
Yeah. Now we work quite a bit with one of our other centers, and they actually have a stronger relationship with the Cancer Control Network here in Oklahoma. Is there any problems with a joint application from two centers in a state?
No, that would be great. I mean, we're looking at trying to reach as diverse a representation as possible, and that would be great if you already have relationships to collaborate. That's great. Other ways that we can help bridge these alliances, provide resources, or help support this relationship building? So far we have connecting key stakeholders, potentially hosting conference calls for those sites that are selected. We would support a joint application by different AHEC centers. Any other ideas or suggestions?
Mandy, this is Rob. I think Edna's recommendation is really strong. It makes a lot of sense. You know, making sure that there's a linkage to the existing centers right now back to the AHECs, so that there's an awareness. And it sounds like there's quite a bit of work happening in various parts of the country. So I would just like to underscore that suggestion and recommendation. I think it makes a lot of sense.
Yeah, that makes sense to me too.
This is Ansley with AHEC, Gulf Coast South AHEC. The experience that I've had with the collaborative that covers 16 counties in our area is people want to be involved, but sometimes they lack the incentives to do the work. So you're asking, is there anything that can help us bridge or support these alliances? I just didn't know, as we plan for this, what kind of, how can we incentivize people to participate? How can we get those stakeholders to the table on top of everything they have to do? See, because I think that's what I seem to experience is that, it's just hard to get that volunteer leadership and the work done, at that level.
Right. No, that's a strong point. And as we've thought about this project, one of the key areas that we think will be important to track over time is the level of engagement and how people feel engaged in their local efforts. You're absolutely right. Everyone has competing demands. How to incentivize participation is the critical question. We're going to be working on that at a high level and trying to produce some kind of alignment tool eventually to help local areas align some of what they're doing with national health priorities. But roundtables will also be helping with that effort, so it's a little bit chicken and egg. So it's an important question and one we can continue to think about. I think engagement and alignment with what their priorities are is key, but I welcome feedback on, if AHEC centers have had good experiences in terms of that engagement process, and we'll also be looking at those strong coalitions with strong practices and bringing that to the table to try to share with you what has worked well in those high-functioning coalitions.
Yeah.
This is Edna again. I'm really sorry about so many questions.
No, it's wonderful. Please don't be sorry.
I'm just trying to kind of visualize the time, how we go through this time schedule that you have. You mentioned that the roundtables will be happening between year 2, 3, and 4. This is just to clarify my understanding. Our task would be to host a roundtable, 1.
Yes.
And what is the expectation follow-up to that event?
That's a great question. So the results of the roundtable is really a report that will help align cancer prevention and chronic disease prevention efforts, and it can be kind of an action plan or next steps for that local community to try to strengthen those relationships so that you can continue to work together going forward. So the primary endpoint is really just a report of recommendations to help align those efforts to integrate chronic disease and cancer prevention efforts. And then we will take that and use that to inform some of our TA activities, but we're hoping that that will help catalyze new relationships and new energy around and potentially find new funding opportunities or new partnerships at your local level to help drive with shared goals some of those recommendations. So it's really a starting point. The expectation for AHECs, the hope would be continued engagement with the Comprehensive Cancer Coalitions and for them to really start looking at you as a key partner in their local community when they're thinking about their priorities and thinking about who they need to work with. I hope that that's helpful. If you have other suggestions in terms of what would be ideally next steps or outcomes from those roundtables, we would also welcome those. we thought
Did you have, as you continue to describe the project, of course we get more questions, but at this point in time, do you have a description of what you expect for the roundtable? Is it a 1 day, a half day, a few hours? How many people are expected to attend? How do we know if it's a success or we have to do another one?
Right, sure. We will be nailing down those details. I mean, I'm kind of making things up as I go, but it would probably be a one-day event. We can talk about this in the process of once we establish our steering committee and establish, flesh out some of the goals, and we want to really get your feedback on what's important to you. But they would likely be a one-day event. There would be some money for food, and I'm not sure, probably, it would vary based on your community, but maybe 20 to 50 people. I don't think that it's critical that we reach a certain number. We don't want it to be 5, but we don't expect it to be 100. So I think some of those things will shake out when we get the steering committee together, and kind of nail some of that down. It's important to note that this project started at the end of September, so the year 2 doesn't start until October of this year. So we have some time to figure out kind of the logistics and some of the more granular information around these. We just want to get started with who's interested, getting those key people on board, getting our steering committee built, and starting to get rolling, if that helps.
Right. And this is Robin, Edna, and others on the call. On the very next slide, actually, there'll be a little bit more specific information about the roundtable, steering committee, et cetera. But one thing that did hamper this and our work as well was the government shutdown, unfortunately. That slowed things down as well. So that may provide just a little bit more of a framework in terms of timing. But this is really the big kickoff, and I'm so glad that everyone is on the call.
Hi, this is Gretchen in Nebraska. I have a question about your interest in special populations. Can you expand a little bit more on what it is you're thinking of in that area?
Well, we're open here, but we're finalizing a needs assessment right now based on key documents that we have about cancer control from the CDC, from other stakeholders to kind of identify some of the needs. But some of the things we're thinking about are Latino populations, African American population, Native American population, rural communities, potentially LGBT community. I mean, it's open, and we are interested. This is one of the areas that I also wanted to get your feedback on. We're interested in creating some working groups potentially around special populations and really leveraging the expertise that you guys have working in your local communities for best practices for this population. So if you have suggestions, we don't want to duplicate if something already exists. We would rather disseminate what already exists, but if there, in terms of gaps in cancer control for special populations, we're trying to fill some of those gaps. Did you have a recommendation?
I was just wondering, we have 3 reservations in our AHEC region and 1 landless tribe.
Mm-hmm.
And, of course, like some of the other AHECs, have a lot of frontier. And so just wondered, how that was going to fit into the listing of populations.
Yeah, I would say the tribal areas are really important to the CDC, and it's something that we would like to focus on. So if there's interest in lending your expertise in terms of best practices in working with those communities and what a resource guide or a technical support tool might look like for that community, we would be really open to your suggestions. And can you just, for my benefit, tell me what your name and AHEC was again so that I can keep track?
Yeah, Gretchen Forcell, and Northern Nebraska.
Northern Nebraska. Thank you. And would others be interested in participating in working groups for that purpose, to help bring together some best practices in working with communities that you know and have worked with?
This is Mary Craig in Buffalo, and I think that would be one of the best ways to reach populations. I'm also curious as to looking at an opportunity in working, because our AHEC is located in a community health center, and engaging community health center populations, which tend to be a mix of all of those diverse populations which you just listed.
Mm-hmm.
That's a great point, Mary Craig.
Mm-hmm.
Thank you.
Hi, this is Ansley with Gulf Coast South AHEC. You're mentioning creating a steering committee, but you're also looking into work groups. Will you clarify that a little bit?
Yeah, sure, absolutely. So the steering committee, are we talking about this later? I don't want to duplicate. The steering committee is a small group of individuals comprised of staff from the CDC, some of the national partners, some GW staff, and up to 5 AHEC program directors or staff that might be, they may be the same 5 that are hosting roundtables. They can be different. This is another point at which you can provide us some feedback if you'd like to kind of spread out AHEC participation, having some representation to help just guide some of the objectives of the overall project. Mm-hmm. So there's the roundtables that are happening for sure, the steering committee, which is more of a leadership opportunity, and then the working groups. One of our goals is to develop these resource guides, and I thought it would make a lot of sense to work with people who are on the ground and have the experience working with certain populations rather than just deferring to the literature or just deferring to what's in print. We really want to get the experiential side. So it's not mandatory. It's another opportunity if you would feel like it would be meaningful and feel like you could lend some expertise in the development of those guides for the improvement of cancer control, then it's another opportunity that we would offer to work with you on. And you seemed like an ideal group in terms of leadership and experience to start with for those working groups. So,
do you? I know this is just kind of in the development stage, but do you have an idea of how many working groups you're looking at? And could you give us a deadline today as to when we should respond if we would like to participate in those?
Okay. So the resource guides, we're going to be doing them again on kind of a rolling basis, like the roundtables throughout the project. So I would envision at least a couple a year. We would like to start with one working group to kind of work out the kinks. I'm going to ask Anne if she has a recommendation in terms of deadline for response, since we're not exactly ready to kick off those working groups just yet.
Yeah, hi everyone, this is Anne. So I think some of the order with which we do them will depend on interest. So perhaps after the call we can send out a little poll, and if people are interested, then we can kind of gauge the level of interest and then start planning from there. And we wouldn't start these immediately, so there's definitely some time to kind of think through the best approach for them as well.
Yeah, so if we send you a survey or if we reach out to you, if you could let us know if you're interested in what special population you would be interested in, it would help us kind of create a timeline for that. I'm sorry, I can't be more exact right now.
No, that's fine. Just to follow up on that would be great, and that way that gives our team some time to think through that and see what we can participate in.
Is it possible for you guys, I don't know who, but to develop like a diagram of the, of the project direction so that, I'd like to see like a picture of where we are and where we want to be at the end of the 5 years, just, kind of a flow chart or something.
Sure, we can work on that and follow up with you. And again,
that would be good, just to see the order of the expectations that you have and some of the deadlines, because that would be helpful as we try to make a decision, where and how to best participate.
Sure, and just as a reminder, this is, the intention of this call is really to kick off the collaboration, kick off the project, and we really want to know what you're interested in so that we can help, kind of create that timeline. We know we want to do the roundtables. That was in the proposal and something we talked to you about when you provided your letters of support. But some of these other options, like the steering committee, the working groups for the resource guides, and really this is a wide open opportunity to let us know in the areas that Gretchen talked about if there are other things you would like to be involved in. We wanted to hear from you before kind of nailing all of that down. So, but we can certainly do that, and this call will help.
Hi, this is David Gross from the Northeast Kentucky AHEC. I had a question related to the target audience. I assume this is going to be practicing professionals, but then along with that, I see that the region that Kentucky is included in, also there's Tennessee, Alabama, and Michigan. So I'm interested in how broad of a target that we would be inviting, or that we would invite folks to attend from. Would it be from all 4 of those states, just a part of Kentucky? If you could speak to that, I'd appreciate it.
Sure. I think that could also vary. Some of the roundtables might be very, more local than others. Some might be more regional, and it's really what will be most actionable, I think, at the end of the roundtable. If it's more effective, we know we can't reach the whole country in 3 years. So, if it's more helpful and will make a stronger impact to work, kind of in a quarter of your state, or around a certain region of your state, or a particular reservation, for example, then I think it's really the importance of the roundtables are to really start those relationships and create some shared goals to move population health forward. Not necessarily, it doesn't have to cover an expansive area. The hope is just to improve population health in a tangible way with some shared goals. So I think that can vary. We're flexible. The CDC is flexible. Again, this is a starting point to try to make improvements going forward. I hope that's helpful.
This is Rachel from Northeast Area Health Education Center in South Dakota. I have a question. You mentioned earlier working with like the chronic care teams in your state. Can you expand upon? I'm actually on our chronic care planning team for South Dakota, and our AHECs does a lot with that. And so I just wondered how you're envisioning this working with that.
Well, I think in the past there have been kind of siloed projects, siloed funding streams from CDC and from national entities for cancer control and for chronic disease prevention. So what we're trying to do is, it sounds like you have a strength in terms of your relationships with the chronic care stakeholders, and what we're trying to do is bring those people to the table with cancer control stakeholders, since historically that wasn't really incentivized and that wasn't really expected. But as people are living longer with cancer and there's a larger number of people with cancer, we're becoming more and more aware that clearly cancer prevention efforts do have a lot of alignment with other chronic disease prevention efforts, and many cancers are more and more longitudinal and people are surviving longer, so some of the impacts also are shared in some ways. So we're looking at folks like you who bring certain strengths and then trying to match them with the program directors and the staff we know in the cancer control programs to try to say, okay, well, we know that obesity is a gateway condition for cancer. It also is a gateway condition for other chronic diseases. How can we work together to reduce that in our community? Or we know that tobacco is a trigger for asthma and also for cancer, so how can we work together? Does that help? So we have the stakeholders on the cancer side. We have names and contact information. We know you have strengths in other areas, and we really want to kind of bridge some of those relationships.
Yep, and that's what I envisioned, but I was just checking.
You're really in it with us. This is the first year. So this project, the technical support assistance to comprehensive cancer control entities, is about 15 years old, but this is the first time CDC has funded us to do this work. The American Cancer Society has worked in this space for about 15 years, but we're kind of, we're getting this off the ground with you, and we saw you as really an innovative and pioneering partner with us. So we're really looking forward to growing this with you and taking your questions, thinking about them further. We're open to criticism. We're open to, things we haven't thought through, opportunities we haven't thought through. So certainly at any point, if you have an idea, if you have, oh, this project would be really cool, if you have, don't assume that we've thought about it. We've thought about a lot of things, but we're really excited about working with you because you represent a lot of expertise across the country. It's just a really rich partnership. So don't be shy in giving us your feedback or suggestions. Any other ideas on how we can be most helpful to you in this process, or other ideas that have come to mind right now in terms of AHEC's role in integrating with our goals for the project? And this isn't, the conversation is open. You'll have Gretchen's email. You can contact us at any time, but this is a great starting point.
That might be it. Those are all good questions.
In terms of process, once we have the information that will help us make a decision, will the next step be like a formal letter of agreement where everything is specified, the deliverables from us, or?
Yeah, that's a great question. So for the roundtables, there will be a scope of work. We will provide funding to support food at the meeting, and that will be clearer about where the roles are. For the steering committee, it's really a volunteer leadership opportunity, and for some of these other opportunities, they're really based on your interest in, again, alignment with what your goals are as an AHEC and how we can work together. But there will be expectations for the working groups, and we'll clarify those, but there won't be a formal exchange. So for the roundtables, yes. For the others, it will be more procedural and based on interest.
And let me ask you perhaps a crass question, but I need to know as an administrator.
Sure.
The only money that was identified initially in the first round of information was related to the roundtables.
That's correct.
Yeah. Is that still correct? That is about the only kind of incentive for AHECs to participate that has some dollars attached to it.
Right, that's true. So like with the Comprehensive Cancer Control Coalitions and with all of the moving parts on this project, we're assuming that some AHEC centers may have more interest in this space than others, that you may have individual goals for your centers that might align with this project that, in working together we can advance. But the specific dollar resources that have been allocated are specific to the roundtables. So I understand that's important as an administrator to ask. We're hoping that this will be a starting point for our partnership and that there may be additional opportunities, some of which may involve funding, some of which may not, to make sure that we can grow the partnership going forward. So it's an important question.
Thank you.
Sure. And in line with that, I guess I would also ask, one of the other areas we're kind of just getting our head around is whether there's some space in terms of the Affordable Care Act implementation, and do you have experience or would you want to work with comprehensive cancer control groups on the impact of the Affordable Care Act? That's another area where there may be potential funding opportunities down the line or not. So does anyone have any experience or interest in that area that seems that they would like to voice right now?
I think that could be an enhancement to even the roundtable gathering. So, in terms of, are we going to be talking about the same thing, or is there a new set of knowledge, perhaps related to the Affordable Care Act, that could be introduced as part of the roundtable, because we might get renewed interest in the topic.
Right.
Interesting. And Gretchen Purcell, this may tie very well to the AHEC program in terms of the our partnership with your colleagues at GW and the policy. as we do customized state-by-state information, resource, and continuing education regarding the exchanges. So there may very well be some nice synergy and alignment here regarding both of those. And Gretchen Purcell, Gretchen is on the call and is the project director for that piece. Gretchen, you may have some comments about that too.
Yeah, I think there might be some opportunities. We're a little limited in that currently our project will end the end of September as we know it and are not sure about after that date. But we do know that the materials are there, and that would be a potential option for centers to also educate health professionals through those pieces that we'll have.
Yeah, there could be some very nice alignment on this.
Yeah, so that actually might not be bad timing if your project ends at the end of September and we're not launching any roundtables until after that point. It could be that each of the roundtables have a section that discusses the impact of the ACA for your particular region, and that might be an important part of the conversation. So that's actually, with those existing materials, there may get a little bit more dissemination and traction out of them.
Yeah.
Yeah, that would be fun.
Well, I'm not sure about fun, but important.
I think it could be.
Right.
You know what I mean?
Okay, well, I really appreciate your feedback, and I think I'm gonna turn this back over to Rob to wrap up this part of the discussion.
Sure, thanks. And if there's any other comments or thoughts, or as you reflect on the webinar and some of the questions regarding being helpful with integrating AHECs into the CCC programs and other ideas that you have, send that information to me, please, and I'll be the conduit to Gretchen. But I just think this is a great opportunity for us, and it, again, builds on what seems to be a growing trend in terms of utilizing the AHECs and our national network to take on and tackle some of the nation's most compelling issues, and we're so well situated to do that. So this is another in a good line of existing and growing partnerships.
Wonderful. So we will move on to the next steps. So in terms of what to expect going forward, and I don't know, Dina, can you advance that? I don't know if, there we go. No. There we go. So we will be developing and distributing an application for the roundtables as well as an application for the steering committee. So you'll have a little bit more information there and can think about that, process it, and think about how you might want to participate. We'll be selecting steering committee participants, and again, there will be time limits for these things, so there may be opportunities if you're not ready to plug in this year. We'll be doing, roundtables again in the third and fourth year of the agreement. We'll have rotating roles for the steering committee, so don't feel like, if this is not good timing, you can either apply and say later in the project is better or plug in later. And then we'll be selecting the roundtable sites for year one, or for round one, year two, and identifying some other engagement opportunities, taking into account some of the feedback from this call, and then we'll also pull together a diagram to send out to you to help you kind of better understand the goals of the project and where we're going with it that Edna recommended, and we'll be following up with you to gauge your interest in potential working groups and specific special populations that you might like to work with us on. Is there anything else I forgot, guys, in terms of follow-up? Okay, great. So again, in terms of final thoughts, we're excited about working on this project with you. We really see this as a starting point, and I think this is a great partnership that we'll be able to grow over the years. This is just step one. We're excited about strengthening our relationship with you and learning more about you. We know that each of you really function a little bit differently at your centers, just like the different comprehensive cancer control coalitions all function a little bit differently. So there's, it's kind of, there's a lot of differences. There's nothing kind of standardized, but that's what's really exciting, to kind of see what emerges and what really works, and to be able to share those things with other communities. So As you know, we recorded the webinar, so we will we'll make that available to you in case you want to return to it and listen to it. And we want to thank you again for your participation on the call, and we promise we will follow up soon. So again, we'll hand it over to Rob for his closing remarks.
Great. Well, thanks, everyone. And Mandy, thank you and the team at GW. And as we said at the top of the call, we had a very excellent meeting in December, and it seems as if the sky's the limit here with working with GW, both on this project and our other project. So who knows what might result moving forward. But this is a really great opportunity to showcase the AHEC program again, and very much look forward to the next 5 years of working together. And certainly if anyone has any questions, please do get in touch with me, and I can refer you to Gretchen, or you can go directly to Gretchen Kolsky yourself. But thanks so much. I'm really pleased with the participation and the interest, and I think we're off to a very good start. So again, Mandy, thank you, and the team at GW, and Gretchen, and looking forward to working with you moving forward.
Wonderful. Thanks. And so you all have Gretchen's contact information on this slide. She is your point of contact, so reach out to her with feedback, questions, anything that you need in any way that we can be helpful to you. And we're excited about starting this journey with you. And unless
Thank you. Thank you.
Thank you very much.
Thanks, everyone. Take care.
Bye.
Bye-bye.
Thanks, Rob.